I need a new channel. I don't know what it's going to be called, but I seem to be doing more videos now talking about story time than I am doing food. You would not believe the stress. First of all, I'm on a lot of medicine. I'm only actually on one antidepressant, but I'm on a lot of other medicines. It's upsetting my stomach like crazy. I just got the phone with psychiatry. Total runaround. So I have a friend, and he's done this. It's called TMS. And I think they call it another thing, too. There's, instead of... Anyway, to make a long story short. It's a treatment where they put this thing over your head. And it has, like, magnets. And it's supposed to like, help with depression. He said it did wonders for him. He actually got off his antidepressants. No doctor, not my primary, no doctor's ever told me about this. Not even that new psychiatrist that I'm seeing that is trying to get me to do ketamine and also prescribe the Zoloft, which I've been on for 5 days, but it's probably going to take a good 8 weeks or 2 months for it to start working for me. Because that's how Zoloft and SSRIs normally are. Everyone's different. Everyone's different, you know. But I need help like ASAP. And if I've been on antidepressants before and they really don't help, that's another reason why they want to try and put me on ketamine. Well, it's going to take a long time to get the referral because it's already been a while. And just doing some research, like the insurance, they try to ignore it. Like they want to pay because it's expensive, right? So, my friend was telling me that he got the magnetic, the TMS. Let me ask Google. Hey, Google, what does the medical term TMS stand for?
On the website mayoclinic.org, they say transcranial magnetic stimulation, TMS, is a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain to improve symptoms of depression. People also ask me, why would a doctor prescribe a TMS? Want to hear the answer?
Sure.
On the website evolvepsychiatry.com, they say, TMS is used to treat various types of depression,
Okay, so I call up the psychiatry, and I told her, I was like, do y'all have that machine there? And then right away she's like, well, I can't prescribe anything. I'm not the doctor. I'm like, I didn't ask that, ma'am. But I'm not going to waste my time to see the doctor again, especially knowing that their psychiatry is booked in this area. Okay. My next, to see her again is like in 3 months, because that's how booked they are. 3 months. Hello? So, I was like, ma'am, I just need to know if y'all have the machine there. She goes, well, even if we have it here, I can't prescribe it. I was like, ma'am, I know that. I was like, but first I want to know if y'all have the machine. And then second of all, I would need to know what kind of doctor I need to see. And she goes, well, the doctor's not necessarily going to put you on that machine. I'm like, I know that. So much of a runaround. I was like, ma'am, just answer the question. Do you or do you not have the TMS, the magnetic thing for your brain? Do you have that at that clinic? She's like, well, you'll have to see your primary doctor. I'm like, I don't understand that. I was like, I just saw a psychiatrist like about a week and a half ago, right? I was like, wouldn't she be the one to prescribe for me to go in for treatment on a machine that helps for depression because she's a psychiatrist? So then she says, well, the psychiatrist here can only prescribe medicine. I'm like, okay. She's like, so she can't prescribe a treatment. I'm like, okay. Like, she's very vague, right? So then I'm like, okay, ma'am. I was like, if a patient wanted to be on the TMS machine, what doctor would need for them to see? And so she was like, well, you would have to talk to your primary doctor. I'm like, so my primary doctor has enough of power or whatever you want to call it to put an order in to put me on a machine that's going to help my depression, but my psychiatrist can't. That doesn't make any sense to me. I said, I will go ahead and contact my primary doctor. I said, but my primary doctor, I was like, where is this machine located? She goes, in psychiatry. I'm like, my primary doctor is in a clinic 2 towns over. I don't even think she probably knows much about the machine. Maybe she does. But does she know as much as psychiatry? She's a primary doctor. She's not a specialist. I was like, I think I have the right department, ma'am. She goes, I'm telling you. She goes, our psychiatrist, your psychiatrist that you saw a week and a half ago, she cannot prescribe she says the words prescribe. She said she can't put the order in for you to be on that machine. She can only prescribe medicine. Well, she put an order in for me to get ketamine treatment, and I'm not going to go pick that up at the pharmacy. That's not a prescription that you pick up at a pharmacy. So then she goes, I was like, ma'am, can you please check on that? So she comes back and she goes, actually, we don't do that here. I'm like, ma'am, what the hell? And then guess what she said? She goes, but I can see what other stuff we do. She goes, we do electroshock therapy. Well, my mother had electroshock therapy. It fried her brain. I'm sorry. I don't want to talk much about it because I'll get really emotional and I'll really upset. And I'll probably talk about it one day. I'm like, well, I'm not going to definitely get that. You know what she said? Then she said, oh, we also do TMS. I'm like, ma'am, you just told me you do TMS. That my primary doctor has to prescribe it, not the psychiatrist. Then you tell me, oh, sorry, we don't have that machine here. And now you're going back and saying that you do? She goes, oh, well, I didn't know what that machine was. Then why did you say that you have it, and then you don't, and then you do, and then you don't? What? Do you understand anything? Hello? This is why I'm so frustrated. This is why I'm not getting the help I need. I've been fucking depressed with OCD, depression, anxiety for way too long. I've lost 3 homes because of my mental illness. I've missed out on so much stuff. I've been locked up in mental hospitals. I'm always going through this bullshit where I'm not getting the fucking right treatment. I'm always getting some fucking runaround. So then I was like, okay, that's awesome. Again, the reason why I'm looking into this is because my friend had it done. He said you have to do it I think every day for a month. The last time he did it was over a year ago, or about a year ago. He said it still works wonders. He goes, it's pretty much cured my depression. He was like, I got off my meds, everything. He was like, it's unbelievable. And and it's also not like, you're not putting things in your body, they're not opening up your brain. It's just magnets. It's just powerful magnets, whatever. The side effects is just a mild headache. It seems very safe. So, I was like, great. I'm so glad you have this TMS. I was like, so, how would I go about then? I was like, would I need to talk to my primary doctor? Because that's what she said. Remember, she said psychiatry, the psychiatrists can only prescribe medicine. They cannot put they cannot put an order in. That's what she said. And that my primary doctor, guess what she said? She goes, well, you'll have to talk to a psychologist. I was like, ma'am, and I know the difference. But I told her anyway. I said, ma'am, what's the difference between a psychiatrist that has a lot of college and schooling and a psychologist which can listen to your problems but can't prescribe any damn thing? And you're telling me the psychologist is going to put the order in for me to get on this machine, but the psychiatrist that I'm already seeing can't? I have to build up another rapport with another doctor, which is going to take time. Not to mention, in this area that I live in, it's a small town, they're always booked. I have my nurse friend. She's been on a 2-year waiting list. 2 years to get into psychiatrist. She sees a psychologist. So it's like, okay, so you're telling me I need to contact the psychologist department. The people that talk to you about your problems. See someone there and then ask, and she goes, we can't guarantee that they'll prescribe that. I was like, I know that, but I can always ask them. I'm sure they will with my depression. So I get off the phone and I Google, because I'm in Scott and White. This is the main hospital in this area. I Google Scott and White psychology. Nothing. I try to reword it. Psychiatry comes up again. So then I call psychiatry again. I get the fucking calling center. I don't get the clinic or the office or whatever. I get the fucking calling center. I can't tell you how many times I've had issues with the calling center. They're fucking imbeciles. They don't know shit. And they don't listen. You have to say the same thing like 20 times and they're repeating back to you, and it's like, I didn't even say that. I mean, if you're not educated about medical, I understand that. But you should at least listen if you have a job. And you're on the phone, earphone. Your primary goal is to what? Listen? So I tell her, I'm explaining everything to her. I'm trying to be so nice and everything. She wasn't rude. She wasn't rude. At all, really. I tried explaining to her what's going on. She goes, so you want the psychiatrist to prescribe these medicines? I'm like, ma'am, I didn't say medicines. I was like, I don't believe this. I was like, I need to know, who do I need to see? I was like, because they're telling me, first she's telling me that they have it, that they don't have it, that they do have it. Well, first she said, you know what I'm saying? And then your primary doctor is the only one. But then you have to do a psychologist. I'm like, what the hell, people? You know, but if I lived in a big city with like tons and tons of hospitals and doctors and psychiatrists and psychologists and treatment centers and machines, competition, I wouldn't deal with this. I wouldn't deal with this. I know I wouldn't. It's not me, people. Because I've talked to so many people around here, and they're like, it's a well-known fact. Psychiatry, psychology in this area sucks. It's horrible. I've talked to a lot of people. You can Google it. You should read the Google reviews. And there's not that many around here, which is really odd. And they come and go. Because the one psychiatrist that I was seeing was not a one psychiatrist. I was seeing this. The psychiatrist would come and go. Like every 2 or 3 months, I would get a new one. And then I stopped going because I got a bitch. And I mean, she was a total bitch. And then they said, you can't switch anymore. I'm like, I was the one who's switching. Y'all switched on me. But it didn't show that way up in the records. So anyway, I didn't see psychiatry for like 4 years. Thank goodness. Even though that bitch is still there, I'm considered a new patient. That's how I got into this recently, which is about a week and a half ago. So, this lady I'm talking to with the calling center, right? I have to reiterate myself over and over and over again, repeating myself, right? And she's reiterating back things that I'm not even saying those things. And so, you know, she's saying, so you want them to pay for the cost of the machine. I'm like, ma'am, it's not a machine I take home. I was like, ma'am, are you familiar with chemotherapy? You know what she said? She goes, well, you know, we're not medically trained. I'm like, I understand you're just a call center, but like, fine. I was like, just write down what I'm telling you. Write this down in the computer. Don't put machine to take home if I don't say machine to take home. Don't say prescribe TMS medicine. I didn't say medicine. If I say the word machine, don't put medicine. If I say at clinic, treatment at clinic, don't put machine for home use. Don't assume things because they might make logical sense to you because they're not logical because you don't take that machine home. So I'm like, ma'am, I was like, can you just dictate? Because she has to send the message over to the clinic. So I basically told her, I was like, patient is inquiring about getting TMS treatment, needs to know what doctor to see for referral to get treatment. Does patient need to see primary doctor? Or will existing psychiatrist do it? Or does patient need to see a psychologist? Because patient, you know, believes that he may benefit from the TMS machine. So, I don't know. What business makes me mad is you have to do this, even though you have to do this machine every single day for like, I think it's I think it's like 2 weeks or even a month. Well, the ketamine treatment, you only have to do twice a week. However, the ketamine treatment, I don't think I'm going to take it twice a week and then not have to do it for a whole year. You know what I'm saying? All these runarounds, like, yes, I'm on the Zoloft. I guess I've only been up for 5 days. I know I wasn't going to get better in 5 days. But the thing is, this is not depression that just popped up and I'm just expecting it. I have no patience for it to go away. I've been dealing it with my whole life. And it has gotten to a point where I don't want to deal with it anymore.